Welcome back all, Pandemic Live. Welcome back to those who were able to attend yesterday's opening session. And welcome to those who are joining for the first time today. When reflecting myself on the opening session from yesterday, it actually reminded me that even if we don't remember all the words and the content of our moments and experiences, we remember how they made us feel. And the opening session for me, it made me feel both grateful and hopeful. Many more things too, but you're welcome. I won't I won't go into more of those, but grateful and hopeful. I found Elder Jean Becker's gratitude prayer centering and an excellent reminder of the importance of gratitude for positive mental health. The greetings offered by Doctors Montero and Fletcher from Renison University College, the Hub's home, were heartfelt, personal, and provided that steadiness and security that we know is so important from home environments, and that too many people don't actually experience that today. The Honorable Carolyn Bennett, the country's very first Minister of Mental Health and Addictions, was live with us for the whole session yesterday, a very hopeful signal itself. And that hope for me really grew when she spoke and engaged in the breakout rooms. What a champion she is for mental health promotion, and she really, really gets it. And she wants to learn more. In her words, we were her brain spa. And what a spa it was in the breakout rooms with all 20 projects from the Mental Health Promotion Innovation Fund. Thanks again to the projects and to the room facilitators for those discussions last night. For those who were unable to hear the opening remarks yesterday, the session 1A description on Whova has 3 short videos now uploaded. Thanks to Eric for such a rapid turnaround. Elder Jean Becker's gratitude prayer, Dr. Wendy Fletcher's greeting from Renison, Minister Bennett's remarks. The full recording of the session will be available post-symposium, but the brief video grabs that are available now are to help you experience all you can while in this space together, knowing that there are many competing priorities for on everyone's time. Now, on that theme of experiencing as much as we can together, I want to remind everybody about the gallery walk. On Whova, under agenda, the gallery walk tab, it remains open and is rich with project material and ways to connect with them. Also in the gallery is the drop-in with Dawn. Last evening, I mentioned the gallery space that is reserved for Dawn and for you. She's eager to see you, to hear from you, to speak with you, whatever works for you. A bonus incentive for today. It seems the Hub neck warmers I mentioned in the opening session yesterday were a hit. So there are limited editions, I'll have you know. So the first 15 people who drop in with Dawn today will get a Hub neck warmer. So transitioning to today's sessions. I've heard so often, this is a good time for the focus of this event on helping mental health promotion flourish, and the chance to gather and just see what happens as we do so together. Maybe it's a good time in the worst of times being the escalating needs in some populations and places, of course, more than others, for improving the conditions of living, the very fundamental determinants of mental health. So we're all here to figure out how to address these very real and very large unmet needs. To help us as an emerging, growing community enter into day 2, the Hub wants to bring you some selections of voices and visuals from the Mental Health Promotion Innovation Fund project, material that they in fact posted in the gallery space that remind us of why we're here, our collective compelling why. Everybody has their own individual compelling whys. This is a collective compelling why. And again, with thanks to the projects for helping to ground and center us on this compelling why. And with thanks also to Eric for developing this, this montage. So Eric will upload the video now.
I think programs like Do You Mind remind us that we have the resources in our communities to take care of ourselves and each other, and that queer and trans youth can be leaders and experts on our own lives. I think it also reminds us that there are so many people out there who care about us and who care about our mental health, and that's really reassuring in times like these.
To promote positive mental health, it needs to start being taught at a very young age.
Mental health is one of the most important things, yet the most overlooked. There is no health without mental health. It needs to be in the conversation. Mental health is not something that you just think of when you are having mental health challenges or when you're experiencing a mental illness.
Connect brought us as foster parents into their world a little bit, and it helped us really let go of the behaviors that were happening in our home, and it concentrated more on our responses.
I really enjoyed the program because it made me look at the way I was behaving myself and showed me that if I'm more positive and look for good things every day, that things will get better. My relationship with my daughter is stronger than before.
On apprend comment gérer notre stress, on apprend que c'est normal, ça fait qu'on n'a plus d'outils disponibles, puis ça nous aide.
I believe that we, as a people who are serving for our peers, for people who are like we are, we can do a lot for others using this program and everything what we can serve here. I have only sometimes feeling that I'm getting in this program much more than I'm able to give. But maybe in the future, if not this, in other program, I can be able to give more to others. But for this moment, I am getting a lot.
And youth can create policy change. You don't need to be some big official with a degree, like an expert. We're all experts in our own experience and our own health. We can take charge of that, and it's even better when we do it together.
It gave me the opportunity to discuss our struggles as newcomers and to learn strategies to overcome them.
We went from multiple tantrums a day, fighting, yelling, arguing, to calmer and happier household.
Made me feel like I was not the only one in these situations with my kid.
Yeah.
C'est vraiment utile, c'est sûr, ça peut aider vraiment beaucoup de personnes dans l'anxiété, puis ça englobe plein de sujets.
Coming into a new country as a child is difficult, and there's not many places where they can process all of those emotions and big feelings that they might be experiencing. And because of all of their past experiences, it can cause them to behave in a way that they might not fully understand. And programs like this give them the chance to recognize how important their emotions are, and that feeling different feelings at different times, whatever those feelings may be, is perfectly okay and normal.
Why should groups like YPG exist? so I can experience that more.
Yeah, we need to hear more of that in our lives.
Well, with that reminder, thank you to everyone for now engaging in day 2 sessions with a focus on actions for helping mental health promotion flourish. It's as easy as A, B, C, and D. I only wish. In relation to the symposium program anyway. 2A, the pre-recorded keynote presentations. Awesome stuff, great stuff from both Carol and Quam to set us up for the real-time sessions of today. 2B is the live dialogue with a panel. 2C, the interactive exchange of ideas in plenary and then in breakout rooms as well. 2D, self-care options. So we'll get into the specifics of each of those as we enter into them. But for now, let's dive right into session 2B. This is the dialogue with 5 panelists. I'm so excited about this. Guided by questions that you submitted and rated over the past week and including up until the last few hours. So you can also submit questions during the session, and I see now that that link is provided in chat. So the flow for the panel, here's how it's going to work. Yeah, I can only plan so much. I have no idea what's really going to happen in the panel, but the flow of the panel, it's about an hour in total. And I will very briefly introduce the main perspective of each panelist. There'll be an opening sort of firing round of 2 minutes from each of the panelists, a mere teaser to get us into the discussion. And then there'll be the open Q&A guided by the questions that were submitted in advance, and then a closing round from each panelist. So that's the basic flow where we're starting, the beginning, the middle, and the end. So the panelists. So grateful for their willingness to be here today, be here with us. Please see their bios under the agenda tab and speakers. I don't want to use our time and our precious time in the session to go through all of those introductions, but to help all of you consider some of the questions that you may have for them. I'll just name the main perspective each brings, and then you'll see that come to life as they're discussing some of the questions. So Claire Betker, the Scientific Director for the National Collaborating Center for Determinants of Health. Main perspective, field building for health equity, especially within the public health system and through the National Collaborating Centers for Public Health. Carol Hopkins, the CEO of Thunderbird Partnership Foundation. You've heard from Carol if you saw the keynote presentations. Main perspective of culture as a foundation for mental health promotion. Quam McKenzie, CEO of the Wellesley Institute, University of Toronto. Main perspective, the central importance of health equity and ways to mind the gap, as you saw in the keynote presentations. Welcome, Quam. Pascal Mentura, Senior Scientific Advisor for Mental Health Promotion, Institut National de Santé Publique du Québec. Her main perspective, a population and public health perspective on mental health promotion, and in particular, a shared understanding of what is mental health promotion. Welcome, Pascal. And the 5th panelist, Brenda Restool, CEO of First People's Wellness Circle. Welcome, Brenda. Main perspective, local and national leadership for First Nations mental wellness. As I'm reading these main perspectives, I'm thinking, oh my goodness, that's just too brief for this panel. But you know what? Better to hear from them than from me. So you've got their full bios that that you can look to. So the opening round with each panelist will share one action. This is our teaser. One action that they think is most needed to help mental health promotion flourish in Canada and why. And that's up to 2 minutes each. And the order we'll just do, it's alphabetical by last name for the first round. And so let's get started with Claire.
Well, you know, one action. So I want to start though by Barb acknowledging the land from which I'm providing these comments. So I'm in Treaty 1 territory, and that's the traditional territory of the Anishinaabe, the Cree, the Oji-Cree, the Dakota, and the Dene people, and the homeland of the Métis. And I respectfully acknowledge that all of us live and work in the traditional lands of the many Indigenous peoples across Canada. And that's now known as Winnipeg, Manitoba. One action, is that what you want right away? One action? Well, I'm going to go with what Kwam said last night. I think we got to fill that gap. And I think we got to work at every level to fill that gap. So that's my action.
Okay, my hunch is we're going to need to ask you to expand on that next round. All right, okay. So over to Carol.
Maimana Bojono, Jam Indigenous Cause Gaye, Mainga Nodem, Lanel Nape Kwe and Dao, Lenape King and Donjaba. Good afternoon. In my world, it's the afternoon already, and I'm joining you from the Delaware Nation at Moraviantown in southwestern Ontario. Glad to be here today. One action. I would say that that's investing in reconciliation. Again, it's a big, broad term, but under reconciliation, it's building awareness. And in my talk, I talked about the awareness of Indigenous knowledge and culture as quality evidence. So if we're building our knowledge awareness of Indigenous knowledge and cultural practices as quality evidence, then we have to think about what those outcomes are. And in my talk, I talked about hope, belonging, meaning, and purpose as the measurable outcomes of investing in Indigenous knowledge and culture. Miigwech.
Wonderful. All right. And there were some questions that were submitted that pick up on those points. And so we'll move thereafter. Kwam, over to you.
So there's always a delay, as you know, to get yourself off mute, but I've managed it. And I'd like to start off by saying thank you very much for having me here, and amazed to be on an awesome panel, just a fabulous panel. So thank you very much for inviting me here and allowing me to be here. Now, I've got a very straightforward pitch for you. I believe we need a new social contract to produce a mentally healthy Canada. I believe that COVID has highlighted and exacerbated inequities and vulnerabilities which were actually long present in Canadian society. I think we've already been suffering through a mental health crisis which has never adequately been addressed and has been exacerbated by COVID. And I think we've been focusing on the health emergency that is COVID, but we haven't been thinking about the mental health emergency. And even when we've thought about the mental health emergency, we haven't thought about the mental wellness emergency. So I think if we're going to try and focus on wellness, resiliency as a foundation for our recovery, we need a new contract, and that needs to be formalized through the co-development and co-implementation of a national 10-year mental health renewal plan. And that would go with plans for each province, territory, and municipality. And I think when we work together, we can do this. And unless we work together to do this, we will not have a sustainable recovery. So what we need is a social contract for mental health.
Fantastic. We'll pick up on that later too. So thank you so much, Quam, and Pascal, for your opening remarks.
Hi, everyone. Thank you, Barbara. Very nice to be here amongst all of you. I would also like to acknowledge the coming to you from Montreal today, from my home in Montreal. Acknowledge the Indigenous lands on which I stand and the Mohawk Kanangahaga Nation, which is receiving us on this land where I'm talking to you from. Apologies, I'm francophone and from Institut National de Santé Publique du Québec. So one action, I've tried to find a way to integrate 6-7 ideas in one sentence. But I think my perspective was really, and tapping into things that were already said, really trying to leverage the pandemic context in order to really tap into the collaborative leadership that is required for a population mental health and wellness perspective. So as has been said already, I think we've really witnessed the importance of the social determinants of health and how their distribution and unfair distribution particularly impacts how health and mental health and mental illness have been affected in various ways for various populations. And so there's been an enormous highlight on that dimension. And so there's really an opportunity and the need has been identified, by the Dr. Theresa Tam's 2020 annual report in terms of tapping into equity in order to move to resiliency and to recovery. There's really a need to focus upstream on the social determinants of health and on equity. And so in order to do that, we need to tap into the various forms of leadership that are essential for this. So that links to the idea of a social contract. We need a strong leadership, of course, from public health to continue moving on this understanding and shift in thinking about the public health perspective for mental health. We need to tap into the leadership from across sectors, really for a broad whole of society perspective for mental health, breaking silos, intersectoral perspectives for mental health, really acknowledging that mental health is actually everyone's business. We need strong leadership and partnerships with Indigenous expertise, as was mentioned by Carol's presentation. We keep on talking about this shift in thinking and shift in paradigm about how we're approaching mental health and how it seems to be a recent approach in the mainstream thinking about mental health. But we've been learning in recent years that it's not at all recent or novelty in terms of the Indigenous expertise, in terms of tapping into holistic ways and wellness. In mainstream approaches, we've had a tendency to artificially, I would say, and mechanically separate physical health and mental health. And we're now talking about holistic perspectives and tapping into strength and recognizing the positive value of mental health. But this expertise is extremely present in Indigenous frameworks and ways of approaching wellness. So we need to tap into that leadership and expertise. And finally, last element, we need to tap into the expertise and the leadership of communities, because we know that whether we're talking about mental health promotion or equity work, how we do things is actually as important or even more important than what we're doing actually. So in terms of really participatory work, community-led work, tapping into multiple voices, really to not only ensure that what we're doing is appropriate, integrated, sustainable, but also because it enables for communities and populations and vulnerable populations to actually gain control on the conditions that affect mental health. And to, as we've heard in one of the videos, eventually also push for mentally healthy public policies. So those are I think, the forms of collaborative leadership areas that we need to tap into for population mental health and wellness promotion.
Love it. Under one action of collaborative leadership. Awesome. I think that,
one thing,
it's fantastic. And what I'm going to do, we will turn to Brenda, but I am going to just plant the seed for others based on these sort of initial teasers that everyone is tossing out. I am going to invite you to respond to each other as you wish after we hear from Brenda in her opening round as well. Brenda.
Ani bojo wapsequence dishnakas magisi dodam okikanda donjaba nishnabe and debendagosa king. I would just like to acknowledge I'm coming to you from the territory of Nipissing First Nation, which is in the Anishinaabe Nation, and my own community which is just across the lake. And so I want to just say ditto. I don't know if there's a lot more that I can say. I agree with Kwam. There's it's a fantastic panel with some really great ideas, and I will build on what, as best I can, what's been said. And I think an action for me is addressing and breaking down anti-Indigenous racism in Canada. I think we really need to look at what Carol has said by investing in reconciliation and recognizing the contributions and the evidence and knowledge that comes from Indigenous people to help in structuring a new way of doing business in this country. Pascal said it best that, we've been learning, but this isn't novel, that we know that the information and evidence of Indigenous people have led to some significant changes in the lives, not only of Indigenous people, but non-Indigenous people. And to be able to use that evidence, knowledge, and the leadership to invest in what Kwam has suggested. And that is about reimagining and re-engaging in a new way of looking at a mental health system in this country. I see that the government has already acknowledged that there is a need to invest in a mental health and addictions system or a mental wellness system for Indigenous people. And that really has to do with investing in equity, that we need to have equitable systems in this country, whether it comes to the social determinants of health and health, particularly in mental health primarily. When we have equity, we can begin to see people flourish, and we can begin to see people have their strengths and their gifts recognized. And I was really pulled by that little vignette at the start of it, and how when we give people the tools and equipment they need from an equity place where we hear their voice, we acknowledge their realities, and we give them information that meets their needs on their terms, based on their evidence, their practice, and their experiences, we see shifts in their well-being. And so mine is that we begin to break down those structural barriers that lead to inequity and address anti-Indigenous racism in this country.
Fantastic. So just little teasers that you've heard from this panel, but there's there's big ideas, there's big systems change, there's lots to work with here. I'm just going to pick up on, and I did say that I would invite you to respond to each other. Maybe if I can nudge one thing into those responses is, we've heard a lot about the importance of investing in equity and the importance of structural and system change for mental health. This symposium is specifically focused on mental health promotion, the most upstream, the most underdeveloped, the most under-acknowledged as the part of the continuum. And so I just wonder, in your responses and your reflections, whether that might come up in just, that spotlighting, that actions that are truly at that upstream end of the continuum. I invite any one of you to start. You can unmute yourselves and in response to each other and building on the comments so far.
So can I just get it right, Barb? You've asked five people in Canada to decide between themselves who goes first, yeah? We could be here all day.
That's rather equitable, didn't it? Gwen, you've just jumped into the queue. You go.
Well, actually, I wanted to jump in because I forgot to explain that I'm joining you here from Geneva today, and so because of that, there's no land acknowledgement, and so that's just wanted to let you know. But I did like the fact that thinking about some of the things that have come up, and I just wondered if just as a bouncing off point. One of the things that has come in a number of different ways is about what happens when we trust people and when we back people and when we produce environments where people can thrive, so that we really we're really thinking upstream about how we create environments where we don't have anti-Indigenous racism, how we produce environments where we acknowledge Indigenous knowledge, how we create environments where we properly fund Indigenous, not just health services, but health systems which are about wellness. And, I loved, as always, hearing about the wellness continuum. And every time I hear Carol talk about it, I see something new that I've forgotten. So it's very rich. And so this is, in my mind, these big ideas are really a question of values and small ideas in some ways. And sort of, the big ideas is, do we trust people? Do we believe people? Do we want people to have real self-direction? And do we want to get rid of poverty, not being just the material poverty, but the poverty of inclusion, which is a different level of poverty? So yeah, I think there are loads of similarities in what we're saying, but we're coming from a different point. But I really wanted to hear more from Claire, because she was going first and was so crisp. But, and I know that there's so much more that she'd probably want to say.
Yeah, thank you. Thanks, Kwam. So a couple of the things that when I said fill that gap, that I was thinking about is at the National Collaborating Center for Determinants of Health, we've held two series of what we call COVID conversations. One actually in April of 2020, the 5 Wednesdays in that very first month of the pandemic. And then one a year later, thinking that maybe we were closing out that pandemic. And here we are, 1 year later from there, and actually planning for another series of conversations. And so when I said fill that gap, we had about 1,600 people participate, and we had 13 policy research and community leaders in those very early days. And, there was really 4 very strong themes, which to me give you that point in those directions of how you might fill the gap. First of all, that there are oppressive and unjust systems. They exist, and there were existing, and at that point we used the present tense are existing health and social inequities. And if anything, this pandemic has made that blatantly clear. You cannot deny that. No one can deny that. Who has a good heart? I don't think. And then you saw health and social systems under duress. Like, it was really trying times, and it's been really trying times for a long time now. And were essentially non-responsive to equity. They did not even recognize or mind that gap, as you said, Kwam, but certainly were, at least in the first year or so, really even under, unable to try to fill or consider how to fill that gap. And that the disproportionate impacts that we saw in your data last night, as I watched it, Kwam, is glaringly clear. Whatever the metric you might use, the disproportionate impact of the pandemic is absolutely driven by structural and social determinants of health, and our lack of collective action to address or fill that gap. But along with that, we heard in both series of conversations is really, I love your words, hopeful and gratitude, but this momentum and community, collective mobilization, and whoever is minding the gap, it's right at that point of care, coalface, or on the ground in the community. It's very local, very local. So that community, collective mobilization, the policy innovations, social transformation, social cohesion, in spite of what we see on the big stage of division and polarization and those kinds of things. So to me, if we're going to fill that gap, and Louis Soren is online here, and you're going to hear from him in another panel, I go back to what he says, which is we've got a fact to tell. You told facts last night, Kwam, we've got the data, we need to do the fact telling. Carol, yours was beautiful, beautiful in terms of the stories, the history, where that evidence comes from, respectfully provided. So we need to do the storytelling. But as Louis says, we need to take it the next level, which is we have to tell the truth. Right? Tell the truth about what's going on out there and what can be done, and the evidence that would inform those bold actions, big ideas. And so fact-telling, storytelling, and truth-telling, and really with that goal of filling that gap. That gap is fillable. And so those are my thoughts, and I'll leave it there.
Thank you. That gap is fillable. Carol.
Yeah, and an example of that is where there are administrative agreements between provincial, federal governments, and First Nations governments. And we use the term co-development often. That can be very beneficial. But in the administrative agreements, it's recognizing the role everyone has to support the whole of the population, including First Nations people. It's an act to demonstrate that the mental wellness of First Nations people is not optional. And so we need all governments on board. And when they come together in an administrative agreement, it's First Nations governing, designing, and delivering their services. It's not adding more to provincial services to do for us. It's coming together in relationship. And so we often talk about the significance and importance of relationship. And so those are mechanisms to ensure that we are collaboratively enhancing services based on Indigenous knowledge and culture. But there are many situations where we don't have those relationships, and we still have the gaps that you're talking about, systems gaps, where is it the province that's going to answer high suicide rates amongst First Nations, Inuit, Métis people? Or no, it's the federal government. No, the federal government doesn't have enough money to do that. And we get into these conversations, and I'm sure many of you understand what Jordan's principle is about, and the Canadian Human Rights Tribunal over child welfare. Those are examples where in Jordan's principle, a boy died because province and federal government could not decide who was responsible for paying for his health care. And they had the solution, they had the medicine, they had the strategy, but it was who's going to pay for it caused a little boy's death. And so Jordan's principle is about, let's make sure that children have access to health care, and we'll decide the policy barriers and the systems levers. And so that's what I'm saying. In those administrative agreements that have been established, and there are examples across the country where they exist, we've seen good results in terms of moving towards more equitable service delivery that starts to then understand those services and approaches within the context of the determinants of health. But it's a long road, and we can't be afraid to take the journey together.
I'm going to thank you, Carol. I'm going to pick up on that briefly. Oh, Quam, did you want to jump in?
Just picking up on what Carol said, and also building on what other people said about investing in equity. I quite like the idea of making inequity illegal. I quite like the idea. I think that we set up a pandemic response that we knew was going to be inequitable. And as we saw the infections rise, and as we saw the hospitalizations rise, and as we saw the deaths rise, we didn't change direction in most places in Canada. We knew this was going to happen. The question we have to ask ourselves is, how can that be reasonable or legal? Should there be a law that says, actually, you can't do that. You can't knowingly set up pandemic responses or health systems that are not going to even try to be equitable. And there is precedent to that. So in the UK, there was something called the Race Relations Amendment Act. And it said that all public services needed to do three things. They needed to promote good race relations. They needed to offer equitable services. And they needed to be able to prove that they were offering equitable services. They had to have the data on request to show that they were providing equitable services, or they had a plan for when this was going to happen. And think about how that could work if we expanded it not just to services, but to systems and to policies. Would that help us start thinking about the environments that we need to live in to promote equity? Would that help us think that, particularly in this pandemic, where there was a gap and still is a gap between what we need, which is mental health promotion, and what we've got, which is a focus on illness, would that equity type of analysis help us think about that and help us create better outcomes? So I do think that there are legislative ways of helping promote this, and the fact that it took, I don't know how many years to get the federal government to pay up over Jordan's principle is it shows that perhaps human rights law isn't necessarily going to be the strongest way of doing this, and that you may have to legislate in a different way.
I'm intrigued too, where I was going to head, Quam, and you filled this gap actually. Carol, when you spoke to essentially precedents in Canada with administrative agreements, and Quam, you spoke to precedents in the UK with certain terms. How might we best use those precedents to support further change?
I'm going to just jump in really quickly, and then I'm going to be quiet. We keep on having a federal government which talks about equity, but then when it comes to the federal provincial agreements, doesn't ensure equity. So there are no strings attached. They want strings attached, and I know there's a federal, provincial, and territorial issues, but the feds have a responsibility for the money they give. And if they don't attach equity strings to that money, and in the mental health transfer, if they don't attach health promotion strings to that, to those transfers, then you say, well, okay, do you really want, is that really what you want? Because if you want equity, then I think you need to follow that and need to maybe have that fight with provinces that maybe don't value equity in exactly the same way.
That's true. And the new child welfare, Indigenous child welfare legislation is a really good example of that. So we have legislation that says and defines the Indigenous child's rights, and so it speaks to the right of First Nations, for example, to define how culture, language, connection to land, and extended family are critical for raising healthy children. So that's in legislation. We don't have policy yet to implement it, but the legislation is really clear in giving directive that can be acted on. But then we have provinces now in Quebec who has pushed back and said, that federal legislation is not going to tell us how we are going to run our province. And so they have disagreed and pushed back on that legislation. That's what CALM is talking about in the health transfers even. Federal government says this is the focus, but they can't tell provinces how to spend it. And so for First Nations, Inuit, and Métis populations who are trying to influence mental health for First Nations, Inuit, Métis, we saw again where provinces said, nope, you cannot tell us how to invest or how to allocate that. That's the inequity that is somehow legal in Canada. And so I really like Kwam's statement about let's make inequity illegal. Transfer payments and powers of authority and decision making can't be the precedent that says services for one population and not for another.
Brenda.
Yeah, I'm really enjoying this conversation and have to agree. I like Kwam's statement about let's make inequity illegal. And I think about the fact that the government of Canada has adopted UNDRIP, the United Nations Declaration on the Rights of Indigenous People. And using those types of global policies and legislation and asking or demanding, let's not say asking, demanding that the provinces have to also identify how they are abiding by, implementing the policies and principles under UNDRIP in which they provide health services if they remain the primary lever in which systems are delivered. So I think when we look at UNDRIP, it talks about the rights of Indigenous people across the social determinants of health. So it allows us to expand beyond the notion of just health and mental health. And it brings into conversation what Pascal has talked about is the rights of Indigenous people to be able to have clean drinking water, to have safe places for children to attend school, to have the right to equitable health systems, to have the right to even something as basic as internet and Wi-Fi services. Our communities have not had that possibility during the pandemic, and so has put us at greater risk. So I think when we look at how do we use existing levers and systems, and your question was, how do we do that? I think it is about data. I think it is about looking at data where we have, whether it be in systems or in regions who have been using that. And so I think about British Columbia, who has outright stated that they plan and are adopting UNDRIP and adopting many of the legislations that have been identified through the federal government around child welfare. And I think all of those, when we look at their data and we see the difference in people's well-being by adopting these, it indicates that they're working. And so it allows us through legislation to say, Your data needs to prove it. And that's exactly what Kwam said. I love that last piece, Kwam, you said about they couldn't just say they were doing, they had to prove it. And I think that's the critical piece is we need to use our data to be able to identify when we invest through those legislations and we invest upstream, that it makes significant differences for children and families and communities overall. And it allows us to see the difference in access to healthcare systems, the improvements in young people going through schools, improvements in the economics. You know, I think there is new information and around things like quality of life and how can we use quality of life indicators as forms of data to show that we're dealing with inequity and we are making investments in the right places to support people's well-being.
There's so much to pick up on here. I am going to tie a couple of ideas together. Carol, you started out with using a phrase, quality evidence. And this whole notion of the importance, the significance of data to give any legislation or agreements any teeth, the enforcement. And so I wonder with this filling the gap, what are some of the, does anybody want to comment on some of the data that is most needed to fill the gap? What gaps are there in these data?
Well, there's huge gaps when systems don't have capacity for data collection. And so amongst First Nations, Inuit, and Métis populations, we haven't had systems to support data collection. Now that has changed with, for example, First Nations Information Governance Center does longitudinal regional health surveys, and they report on that data. And so we've improved the climate and appreciation for data and using the data for our own needs. That has been a significant shift. And we have First Nations across the provinces who have their own epicenters where they're monitoring their data. The problem is we don't have a response to the data. And so one of the things that I always say when people give speeches about suicide and rates of suicide, it's like, well, what number triggers the change? Where is the magic number? Is it, it's not, 11%, it's not 19%, or those high rates amongst Inuit populations. We've been talking about the outrageous rates of death by suicide amongst Indigenous populations. But where's the response? Where is the response? We have provincial data that talks about the gaps again, suicides amongst First Nations and Métis populations in the province. So the province knows that, but there's no investment. There's no relationship. There's no willingness to enter into an agreement. And so data is critically important, but when there's a lack of response to the data, that's a crime.
Brenda.
I realized I was off mute the whole time. Good thing I was quiet instead of cheering you on there, Carol. I wanted to say, I think one of the other gaps around data, and Carol brought up the point already, is that we need to invest in the collection of data and have the resources and ability to do so. I think it's also about, there's a gap in when data is collected, that it's reported. And that I think is similar to what Carol has said. So we know government at the provincial level are collecting data, but they are not reporting on whether that data is making a difference. And so we don't have a way in which to measure where we're seeing the differences occurring, and not to be able to have the conversations about why they're not occurring. And so if they are, providing sort of a standard type of a program across different cultural groups and it's not working, we don't know that. So it's leaving it to folks like, some of my esteemed panel members to say, you can't have the same response for Indigenous people or Black people. It needs to look different, and there is no data because it's not being released in that way, unless we go to the part saying, see, we've got these high rates of suicide, we have kids not staying in school, et cetera, et cetera. My other thing around a gap is that some levels of government truly are not collecting data, or they're collecting terrible data. And so Carol and I have had conversations at one jurisdictional level they've asked us about mental wellness data. And when we push back and said, well, what kind of data do you have? They have limited data. And they are not able to make any comments about the data that they have because they're not collecting it. And they're not doing so in partnership with the people that these programs are meant to serve. And so that becomes a gap. They're not collecting it. They're not collecting it with information that's going to be usable, and they're not collecting it with the people in which the information is going to be most important for. So I think those are gaps that we need to attend to.
Gwen.
Yeah, no, I totally agree with Carol and Brenda. I mean, in a data age, if you're not counted, you don't count. That's it. You don't count. And if you have a right, but you have no way of enacting that right, it is not a right. So there's got to be a way of enacting your right. There's got to be a way of making your needs visible. And that can be through data, but it can also be through narrative. Because sometimes narrative is deeper than data. But those data, then we've also got to be thinking about three other things. If we see disparities, what is the level in which a law kicks in and says, no, you can't, 5% maybe, 50% what? That can't happen. You have to have a plan to decrease that. So there's that. Remember, we're talking about inequities, not inequalities. And inequities are avoidable differences between people, right? These are avoidable. We're talking about inequities. So there's got to be a level at which we can't really live with that. We've also got to think about two other things: building the capacity of communities to be able to access and use their own data. So we've got to think about that. And then we've also got to be thinking about data ownership and data sovereignty, and making sure that when we're talking about more data being collected, sometimes by people who are not sure what they're going to do with that data, that there are some checks and balances on that around communities being able to access and use those data, so the data is being used in their interests rather than in other people's interests. So I think there's a bit around the collection of data. The government should not enact policies without being able to see who they reach and who they don't. Not being able to say who got the serve and who didn't is problematic. But that should be the same for service systems and all of the people who are thinking about promotion and prevention. So I think there's a lot of data that we could have, but that ownership, sovereignty, data use, transparency, and some ethical rules around the use of data might be things that we need to think about.
Thank you, Gwen. Claire.
Yeah, I just really want to build on what Brenda was saying, who built on Carol, and Kwame, you added to that. But much of that data is collected by practitioners, right? By those who are in relationship, either with individuals, families, communities. And I'm a registered nurse, and I'm not so sure that we practitioners are involved in that data collection process enough and understand its importance and how to collect it respectfully and in a way that tells that story, or even the opportunity we have to collect it the best way that we can. So I think and I think we often forget that there's actually human beings in the middle of that collection of data. And it's certainly not something that's necessarily part of our basic education, perhaps even of our orientation. But I also think that what I would add there, and Kwame, you said it as well, is that there's a narrative and there's a story. So while that practitioner is in that home, in that community, on that street, in those places and spaces that people live and see where policy, systems, service, impact on their day-to-day lives, health and well-being, that along with that data, there needs to be that capacity to tell those stories, and not only the stories of what's not working or wrong or whatever, but what's going well, what actually does make a difference, being able to lift up those stories of success and strength so that you can build on that versus that problem saturated. And then I think it's very important that data be able to be disaggregated, and we need to step into that and work at it to be able to keep evolving those systems. Because I agree with you, Kwame, things are implemented, services are developed, policies are made, and they need to be done always looking for what difference did they make, if any difference at all. What was the intended? And then, of course, always in collaboration and partnership with those that are going to be affected by that. Always, right from planning or early conception stages all the way through. So just some thoughts from a practitioner perspective.
Thank you, Claire. Pascal.
Yes. Just adding a few elements in terms of what has been said. One thing I just want to state the obvious really is we've been having a conversation profoundly about equity, and it's interesting because it really reveals and highlights the fact that we initially were talking about mental health and wellness, and we cannot have a conversation about mental health and wellness without talking about a conversation on equity. And I think what's happening now in this panel really is a demonstration of that profound dimension, which tends to be sometimes forgotten when we're trying to address mental health, that it's really about an equity conversation, because addressing those profound structural determinants is what's required in order to actually even start or begin a conversation about mental health. So I find that really interesting that we've kind of dived into that, which is obviously what should have happened, and extremely interesting that it did. I also want to add a little bit about some things that were mentioned in terms of needing the community connections in order to gather the appropriate data, needing community capacity for that, but also in terms of what was said about what types of data and the disaggregation, yes, but the narrative. So if we do want to be able to connect with some meaningful types of knowledge and the narratives, we also need to have the appropriate structures which are going to be able to acknowledge that type of knowledge and that emergent type of knowledge. We need to have shifts in our approaches to epistemology, to methodology, in order to be able to actually integrate those valid types of forms of knowledge that are so pertinent to what we're talking about today. So those are structural shifts as well. And we're also talking about impacts in terms of high-level determinants, policies. We need to have appropriate methodologies to study systems and collective impact on the impact on mental health and equity. And so these are all elements that need to be strengthened and developed and integrated into our workforce and our practices. So yeah, that's all I wanted to add.
This is, I mean, amazing food for thought for 2C, where we will all be, putting forward some of these actions most needed for mental health promotion. I'm mindful of the time here. I would like, the question that was most highly rated for this panel, and it's come out a little bit, and maybe I want to shine a little bit more of a light on it right now, is what about this moment in time? The pandemic context being so important. How might we use it most effectively for advancing mental health promotion?
Well, I might start, and I'm going to just add to what Kwam said about what equity or what an inequity is. An inequity is not an inequality, and that conflation is highly prevalent out there. That an inequality equals an inequity. And Kwam, you said that you know, an inequity is where that difference or inequality is avoidable. But what that means is we know what to do about it, in my mind, anyway. If it's avoidable and we acknowledge that it's avoidable, then there is a collection of actions, multiple systems, Pascal, as you were talking about. So we know how to avoid it. And it also requires a values judgment, where you got to go deep, both in yourself as an individual, in an organization, within society, and ask yourself, is it fair? Is it just? And an inequity is an inequity when it's deemed as being not fair. And therefore, are we going to tolerate it? Back to the, you know, the big hammer of legislation, or whether it's within a community or an organization. So I think remembering when we use that word on the heels, or as we come out of this pandemic, because that word is everywhere, inequity, and taking the time to sort of lay it out and really ask some of what I think make many people uncomfortable questions, so that we can examine what are those steps forward at all levels.
Now that equity is more in daily conversation and in dialogue and getting beyond a notional acceptance of that, Kwam.
So, I mean, I think that we need to focus not just on the pandemic, but on the recovery. And one of the things, whether it's the economy or whether it's society, we have to realize that the big driving force for that, the driving force for our wealth, is less about things that we produce and more about adding value through our thought economy or through the service economy. That's the vast majority of jobs. Yes, we do create things, but the vast majority of jobs is a service and thought jobs. And those jobs are different from the jobs we had before. You know, 100 years ago, our jobs were mainly about labor. And so we evolved societies and health systems to look after people's physical health, because you needed people physically healthy to work to create wealth. Well, it's different now. For service economies and for thought economies, you need people who are mentally well. And so we have to, if we want a sustainable recovery, evolve our way of thinking. We don't need to forget physical health, but we need to increase mental wellness. We need to think about mental wellness, because we can't have a sustainable recovery unless we can move people from languishing, from problems at school, from problems at home, from problems at work. We have to move people out of that to another level, which means we have to work out how we help people flourish and what we need to do to create societies that allow people to be mentally well. And it is difficult because it's a culture change, but it's a really necessary culture change. And when you start looking at even some of the Scandinavian countries, that's how they're thinking. Yeah, they're thinking about creating sort of wellness societies with people who are much better set psychologically to deal with the new world that we live in. And so I think if we focus on the recovery and we say, what do we really need to move from where we are now to where we want to be, we can increase the conversation about health promotion, because in many ways, we are talking about, when we look at the National Housing Strategy, how can we use that to promote mental wellness? When we look at our infrastructure plans, how can we promote mental wellness? When we're looking at the mental health transfer, what can we do to promote mental wellness? And then we can start thinking about, well, what do we do with our national poverty strategy? How do we work that to actually think about how that can help us promote wellness? What can we do with a bit of the budget? I really liked what Pascal was saying about participatory budgeting. How can we get people involved so we're part of the solution to our own lives? It's that sort of thing. Yeah. How can we walk the talk, not just talk the talk about Indigenous sovereignty and truth and reconciliation? What are we going to do there? How can we make that part of thinking about mental health promotion and mental wellness? And I agree with Claire. We know what to do. We know what to do. We do need to do it. And I'll just tell you a joke that in psychiatry, and I'm a psychiatrist, a great idea without implementation strategies is called a delusion. And I think we've got to move from the delusion to actually make this a great idea. And I think there are ways of doing that. And so every time you see someone with this great idea in government that hasn't got an implementation strategy, that's a delusion. And I think we can work past that, because we know what implementation looks like, because Claire's, and others have said, well, we know what to do.
Fantastic. We are, I think we could continue this conversation all day. I'm going to invite us to move into our final round, and that will go in reverse order that we did. I do want to maybe just seed a couple of things. One, Quem, in response to your psychiatry joke, it reminds me too of the relationship between vision and action, that vision without action is useless and action without vision is dangerous. So same type of idea. We've got to bridge, that gap, everything in between. Now, speaking of those gaps and the bridging, Pascal, I want to come back to your initial idea, that one idea of collaborative leadership. But what we've heard in this conversation is, the very macro level administrative agreements, transfer payments, and very macro collaborative leadership. And we've also heard about the importance of the collective mobilization, the very local. I've often heard the phrase hyper local, activity that is so needed. And, this symposium coming together, the sort of spotlighting of the projects within the Mental Health Promotion Innovation Fund, that very local type of activity. So and this ensuring equity, perhaps at all of those, at those levels and everything in between, whether that might feed into some of your closing remarks. So I will invite in the reverse order. This is for your closing round of remarks. So Brenda, you'll kick us off. Thank you.
Jump-ins. It's been an interesting panel. What will I say for opening remarks or closing remarks? My brain's just going in so many directions now. I think because you kind of pointed us to micro, we've done a lot of fantastic conversations about macro. For me, one of the things I had jotted down was the importance of Indigenous people leading the planning, the design, the implementation, not only of programs, but of data collection, data usage, and how to take that data and transform it into meaningful change. So that means at a micro level, we have to start with relationships. Relationships are critical to making change, because I think about, this is where my mind has bounced around, is if we start to create real equity and give people, different cultural groups, equitable access to resources, funds, and tools, one of the things that will come up and has come up is comments like, well, that's my tax money that's paying for Indigenous people to have blah, 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 whatever it might be. And so I think we need to be looking at building and forging relationships between Indigenous communities and non-Indigenous communities, organizations, where we are building up competencies and understanding the realities of different cultural groups, so that we could see the value not only in their evidence and in their practices and in having their voice heard, but the value of investing in each other. And until we are at a place of investing in each other and recognizing that we all bring something to the table, similar to what our teachings tell us about holistic health, it's not just physical, it's not just mental, spiritual, and emotional. It is also about making sure that we're investing in everybody at all parts of their being and all parts of their life, family, community. So I think it really is about creating relationships that build competencies and allow people's voices to be heard, so that we can see some changes. Don't know if that's too micro, but that's really where I think I'm going to end our conversation today.
Thank you, Brenda, so much. For someone whose mind was going in many directions, wow, you really crystallized a few very key points. Next on the list, Pascal.
Well, I think I'll be going along the same lines, and I there's an image I like when that I've used a few times when I speak about this, and I think it leaves a good memory of what this means. I think we're trying to move away from an illness perspective to a wellness perspective, and when we put those two words side by side visually, we see the I in illness and the we in wellness. And the idea really, when we just can remember that, the idea that we could be alone in illness, but when we're aiming towards wellness, it's really about the we. It's about connections, interactions, inclusion, the capacity to contribute, the capacity to connect, not only with others, within ourselves in a holistic way, and ecologically with the planet. It's about the we, and so this is where we're heading. In order to do that, we need a strong workforce. We need integration of that perspective in various areas of society. And we need strong evidence, bringing the evidence forward in terms of what works for that we to happen. We need to use the evidence we have and build the evidence and adapt the evidence. And for that, we need strong leadership from the local, from communities, and a bit of what actually, to finish in terms of what the hub is doing, the fundamental idea of learning practices, connecting environments which are actually developing interventions with researchers, with various ways of developing knowledge, various epistemologies, various methodologies, in order to actually constantly produce knowledge and transfer that knowledge appropriately, so that we're moving forward towards that idea of we and wellness. So I think that would be the sum up of what I had to say.
Thank you very much, Pascal. Thank you. Quam.
Yes. So, as I said, we will we should focus on the recovery because we will have a recovery. But we should also remember that the most likely thing is we're going to have another wave. And the question is whether we will be more resilient next time round. And I believe that a social contract for mental health can actually make us more resilient. It can. Mental wellness will increase our ability to bounce back. But it's not just what is covered, it's how we do it. And this idea of a national inclusive conversation, which brings about a new social contract that thinks about and leads to fundamental change, that can focus on equity, that should focus on relationships, that can and will need data and monitoring, that leads to action, but also changes in legislation to protect us and therefore promote our health. I think that could lead us all to be part of the solution, all important parts of society to be part of the solution. So I think that social contract for mental wellness to kickstart and really codify our mental health promotion strategies is an important start and an important way forward. And I think it could pull together a number of the different ideas that have been talked about here into a framework that could be useful.
Carol.
Thank you. I have sort of three ideas, and I'm going to go back to the montage. And I heard the word big feelings in that montage. And you started out, Barb, by talking about some big feelings, hope, gratitude. So I think one thought I have is not to be afraid of those big feelings, to notice them, let them in, both to your heart, into your spirit, into your mind, into your body, and honor those big feelings. We're in a time where I think there will be big feelings, and Kwame, you remind us that there could be another way. The other thought that comes into my mind is we do need to put that gaze and lens upstream. And anybody who's paddled or tried to, row in a stream against it and upstream knows it's hard work. Not going to come easy. And sometimes you have to go over into an eddy and wait for a while and take a breath and rest and kind of regroup. But it's doable. You can paddle upstream and go towards the headwaters. We need to understand those headwaters. We need to understand what's going on upstream and really put our gaze and move up there. And then the third thought I had is in response to what Brenda said about leading. And as a white privileged woman in this country, we also have to be prepared to follow. So the leadership of others, and followership takes skill, knowledge, commitment, some honoring those big feelings. And so leadership, yes, but followership as well. And back to the montage, there were some voices there that gave some very good ideas that we could follow and put our privilege and our support behind to get to that other and better place. So my thoughts.
Thank you, Claire. And a final word, Carol.
What a privilege to have the final word. My goodness. I think one of the things I want to say is that we've all shared pieces of a puzzle to both vision and to action. And I'll finish with all of those pieces fit within hope, belonging, meaning, and purpose. Everybody wants to have hope. They want to have hope for the future. They want to have hope based on their worldview and their lens and the things that make meaning to their lives. We all want hope. We all need to know that we belong. And from a First Nations, Métis, an Inuit perspective, we know we belong to this land. We're not visitors. We're not problems in Canada. We belong to the land. We are from the land. We belong. And our health and wellness is not optional. We belong in relationship with all of the visitors that have come and made this country their home. We belong in relationship, and those relationships are critically important for developing an attitude towards wellness, an attitude towards life that has meaning for all that call this land their home. We all belong. And we have to find meaning in difference. And that means having the courage to examine what is ambiguous, all the things that we don't know. We can't be afraid of all of the things we don't know or we don't understand. So we have to examine our own ability to live within. What is our courage to live within that space of ambiguity so that we can learn to understand from many perspectives that creates a sense of purpose. A health promotion is making sure that we all understand we have purpose. Our lives have meaning. And our purpose, I think we've talked a lot about equity and inequity. And, you know, the social contracts, we can't get to social contracts when we're still stuck in a certain position. When we don't understand that position, it doesn't matter if it's different than mine. It has meaning and it has purpose. And we need to understand what those are, but be amenable to creating a sense of purpose that is inclusive of all. And, you know, getting away from, you know, whose responsibility is it? Under what jurisdiction do you have responsibility? We all have responsibility to promote and to create an environment that nurtures life to its fullest. That's a central teaching from Indigenous knowledge. The Creator gave us everything that we need to live a good life. And our responsibility is to create the environment that nurtures that good life. And then that's the wholeness. And so, you know, the social contracts, looking at the equities, using our knowledge, appreciating the cultural differences and worldviews, understanding relationship, I think is what holds all of the elements that have been talked about together as one vision with many paths, many actions. Miigwech.
Beautiful. I must say, where I started today was expressing those two big feelings, Claire, of gratitude and hope. And I must say, this panel has only amplified those big feelings. And you have more than done your job to feed our thinking, nourish our hearts and minds and souls to feed into the next session on really putting our energy into helping to identify those actions most needed to help mental health promotion flourish in this country. And honestly, you know, this idea of a new way for mental wellness that at its core focuses on hope, meaning, purpose, belonging. And all of you have named different levers to help make that happen in this country: the relationships, the data, the legislation and its enforcement, the storytelling, the research, the leadership and the followership. So this is just an amazing richness to move into our next sessions. And I just cannot thank you enough. I will do so on behalf of all participants within this symposium, and just our deepest gratitude for your presence and bringing your wisdom and spirits and minds and hearts into this forum. Thank you. We will reconvene in another 30 minutes, and we will. I do want to say too, for those of you who may still be on, that for the next 20 minutes, Dawn, drop in with Dawn. She'll be in her Zoom room, and she would love to hear your reflections. Thank you so much, and we'll reconvene in 30 minutes. Bye for now.